Bismillahirrahmanirrahim. Today we are going to have a brief lecture on pelvis and abdominopelvic cavities. Pelvic cavity and abdominopelvic cavity. Now, abdominopelvic cavity is one continuous cavity. It starts from the diaphragm above, which is almost enclosing the thorax, and it goes well down into the pelvis. So this is an abdominopelvic cavity, and for the purpose of description it has been divided into abdomen and proper pelvis, which is much lower down. The abdominopelvic cavity inside is lined by the peritoneum. The peritoneum is extending right up to the diaphragm above, but below in the pelvis, the peritoneum does not go lower down up to the true pelvis. We'll be discussing this later on. Now let me start with the proper pelvis. Proper pelvis is bounded by the two pelvic bones, or the hip bones. They are united in the midline by pubic symphysis. Let's talk of the boundaries of the pelvis. Boundaries of the pelvis are: one is the anteroinferior boundary, this is posterior-inferior boundary, and these are the lateral boundaries. Starting with the anterior boundary is a shallow one, whereas the posterior boundary is much deeper. Starting with the anterior boundary, the bony landmarks are the pubic bones. This is pubic symphysis. These are the two pubic bones, and these are the pubic tubercles. And midline is the pubic symphysis, and this is pubic rami over here, and that's another pubic rami. Pubic rami and the ischial rami. This is pubic rami, these are the ischial rami, and that's the pubic symphysis. So the anterior boundary is formed by the bony part of the pubic rami and the pubic symphysis. And laterally on either side are the muscles over here, which we'll be discussing here. And the pelvis is divided into two parts: a true pelvis, which is inside, and a false pelvis, which is above. This is known as the boundary is the pelvic brim. This is known as the pelvic brim or pelvic inlet, and these are the iliac fossas. Iliac fossas are part of the false pelvis. Iliacus muscles over here. The true pelvis is below the pelvic brim and goes up to the pelvic diaphragm, which is the levator ani. So the anterior muscles are attached to the pubic bones over here, and these muscles are the part of the levator ani. They are known as the pubococcygeus and puborectalis muscle. We'll come to this in a minute. So the anterior boundary is very shallow. The lateral boundary is formed by obturator internus over here. This is a part of the obturator internus, and lower down it is formed by the levator ani. This is levator ani. The obturator internus is arising from the inside of the obturator membrane. You can see the obturator membrane over here. That's the obturator membrane. This is obturator foramina. That's the lateral boundary of the pelvic cavity. And the obturator internus is arising from the obturator fascia over here. This is a part of the obturator. That's the part of the obturator internus. The levator ani is rising from a tendinous arc, which is attached to the obturator internus. This tendinous arc can be seen over here, also known as the white line. starting from the pubic symphysis, going lower down, deep, and attaching to the ischial spine. This is the tendinous arc of the obturator internus. One over here, one over here. And the levator ani and the obturator internus. Obturator internus forming the lateral wall on either side. The levator ani is forming the floor of the pelvic cavity. Floor of the pelvic cavity will come to a floor in a minute. Then we come to the posterior wall. Posterior wall is formed by the sacrum and the coccyx. It is much more deeper than the anterior wall. This is the sacrum. The sacrum is also forming the roof of the posterior wall. It's sort of a roof over here. You can see better over here. That's the sacrum forming the roof and the coccyx forming the lower part. So that's the posterior wall. Now we come to the origin of the levator ani. The levator ani is forming the floor of the pelvic cavity, and it has got several parts, starting from the part which is rising from the anterior pubic bone and the anterior part of the this arcuate tendinous arc. These fibers are the most medial fibers of the levator ani, and they are going around the anus. That's the anus opening. This is urogenital opening. This is anus opening. So they are going around the anus, and these are known as puborectalis. Puborectalis part of the levator ani, and this puborectalis forms a sling between the junction of the rectum above and the anal canal below. And this sling, puborectalis sling, helps in continence of the feces. Above the puborectalis sling is the rectum, which is dilated part, that is known as the ampulla of the rectum, and below is the anal canal. So the feces are for a short time stored in the ampulla of the rectum, and once the levator ani relaxes, then there is a urge for defecation. So this is a very important mechanism for continence of the fecal matter. Levator ani part, which is puborectalis. More laterally are fibers which are arising from the more distal part of the arcuate line. These are known as pubococcygeus, puborectalis, pubococcygeus, and some fibers are arising more distally from the ischial spine. These are the ischiococccygeus, and more posteriorly is the coccygeus muscle. That's the coccygeus muscle. So the floor is formed by the coccygeus most posteriorly. Coccygeus is arising from the sacrum and coccyx, and more anteriorly by three regions of the levator ani. The levator ani has got opening in anteriorly, urogenital sinus. In male, it gives passage to the urethra, but in female, it gives passage to the vagina as well as the urethra. And posteriorly, it has got an anal opening, and in between the two, when we will talk of the perineum, there is a central perineal body. So, completing the anterior wall, completing the lateral wall, and completing the posterior wall, that's the anterior, lateral wall, posterior, and the floor. These are the boundaries of the pelvic cavity, which is inside. The pelvic organs, true pelvic organs are, look at it, true pelvic organs is bladder, and in female you will get between the rectum and the bladder you get uterus and fallopian tubes, uterine tubes. The two pelvic organs are bladder in front, uterus in the middle in female, and most posterior is the rectum. This is the part of the rectum. This is a male specimen. That is rectum, and you get ureters on either side, iliac vessels, common iliac, that is the internal iliac, this is the external iliac, and that's the aorta, this is inferior vena cava, and the nerves, sacral plexus, all the nerves over here. Some of the abdominal organs also are in the pelvis. This is a specimen of the intestine, and that's the transverse column. These are part of the small gut. So small gut loops are also inside the pelvis, and they can be easily brought up into the abdomen. And this is done during laparoscopic surgery. When you want to operate on the lower parts of the abdomen in the pelvis, you tilt the head down so that the intestines and everything goes higher up, and you get a plot view of the better view of the pelvic cavity. When we come to the peritoneal reflection of the in the pelvis, peritoneal reflection in the pelvis. Peritoneum is lining the abdominal wall inside. Now that's the anterior abdominal wall, and here is the peritoneum. This is a male specimen, and the peritoneum is coming from the anterior abdominal wall. Peritoneum is the most inner lining of the anterior abdominal wall, and it's sitting on the upper surface of the bladder. So this is known as supravesical part of the peritoneum, supravesical fold, because it forms a fold over here. And on either side, it's a paravesical fold. Then it dips down in the posterior wall. That's the upper surface of the bladder. This is the posterior surface of the bladder. So the peritoneum is covering the upper surface, posterior wall, up to the almost seminal vesicles over here. And so the bladder is subperitoneal. Once the bladder is distended, it rises up. If the bladder is full, containing about 400 to 500 cc of the urine, it rises up into the lower abdomen. And when it rises up, the fold of the peritoneum is taken back posteriorly. So the bladder is almost on the just beneath the anterior abdominal wall. And you can puncture the bladder anteriorly, that is, and to drain the urine in emergency, that is known as suprapubic cystostomy. Puncturing the anterior abdominal wall and going into the bladder. You are not going to enter the peritoneum, because peritoneum is also lifted up during distension of the bladder. So you are safe enough, and you can do an extra peritoneal aspiration of and empty the bladder. Now posteriorly, the peritoneum reflects from the posterior wall of the bladder into the upper part of the rectum. This is known as the rectovesical pouch. This is known as the rectovesical pouch. And then it continues on the upper surface of the upper rectum. Now peritoneum here in the upper rectum is covering the anterior wall as well as the lateral wall. Peritoneum in the middle third is only covering the anterior wall, and the lower part of the peritoneum is lower part of the rectum has got no peritoneum. So rectum can be divided into three parts: upper, middle, and lower. Upper part is covered by the peritoneum laterally and anteriorly, Middle part is covered by the peritoneum and clearly only, and the lower part is without any peritoneal covering. Now that is the rectus. This is rectum. Above would be sigmoid colon. So this is recto-sigmoid junction. Sigmoid colon is totally intraperitoneal. Sigmoid colon above is covered all around by the peritoneum. So this is a specimen of the male. I'll show you the specimen of the female. I think I've covered the specimen of the female last time, where there was in between the bladder and the rectum is the uterus, and you get a fall of peritoneum from the bladder into the uterus, that is known as the vesico-uterine pouch, and between the uterus and the rectum, that is known as the recto-uterine pouch or pouch of Douglas. That's some of the times, some of the pelvic organs. Normally, I told you was coming from the abdomen. Sometimes, if the kidney has not descended during embryological development, the kidney descends from higher up into the kidney ascends from the pelvis into the abdomen. Now, sometimes the kidney fails to ascend higher up, and you get a pelvic kidney. So, pelvic kidney is an abnormal kidney which is congenitally not ascended up into the abdomen, and it is in the pelvis. And sometimes the kidney gets inflamed, or if a pelvic kidney gets inflamed, you can have a difficulty in diagnosing it from the appendicitis. So that's a short brief description of the pelvis, and we'll continue it next time. Thank you.